afternoon. This is Dr. Noel Peterson. I'm a board-certified cardiologist in Greenville, North Carolina, and today we are going to talk about recognizing the signs and symptoms of heart disease. Most people's perception of having a heart attack is having some severe crushing chest pain, almost like an elephant or something is sitting on your chest, becoming sweaty, turning gray and ashen, and almost falling to your knees. But in reality, heart disease tends to present very different from that, with much more subtle symptoms. Sometimes chest pain may present as an uncomfortable sensation in your chest, maybe a squeezing or just a funny feeling in the chest. And sometimes it may not even be in the chest at all. It may be located in the shoulders, in the arms, in the back, in between the shoulder blades, or even in the jaw. Heartburn. Heartburn and indigestion are very common symptoms of a heart attack. So people start chewing Tums and, sometimes it's relieved by belching, and they think that they just have indigestion. But in reality, it may really be the warning signs of a heart attack. Having flu-like symptoms may be the sign of a heart attack. I can't tell you how many countless stories I've heard of people or people's family members who just thought they were coming down with the flu and went to bed and they just never woke up the next morning. So if you are having flu-like symptoms, but they might be just not quite right, or you might have a little bit of a funny feeling about them, or you might not have been exposed to anybody with the flu, always keep in the back of your mind that that can be one of the warning signs of a heart attack. Breathlessness. Either being shortness of breath or having a feeling that you just can't catch your breath, or of breathlessness, or if you sound like you're short of breath when you're just trying to carry on a conversation, or even sometimes people are even panting when they're trying to carry on a conversation. And a lot of times, especially women, we tend to just say, oh, we're getting older, oh, we haven't been exercising, oh, we're just out of shape. But again, unusual shortness of breath, feeling breathless, feeling like you can't catch your breath, a lot of times these may be the signs of a heart attack. Hot flashes. Hot flashes, increased sweating, dizziness, and even nausea may be the warning signs of a heart attack. Fatigue, especially new onset fatigue. Not the usual, I'm kind of tired by 3 or 4 in the afternoon, but I kind of just keep going on with my day. I'm talking about the kind of fatigue where doing something pretty simple like, picking up your laptop and moving it, or just very minimal activity just makes you completely worn out. A lot of times this can be one of the warning signs of a heart attack. Not being able to sleep, either falling asleep or staying asleep. In the month preceding a heart attack, 50% of women have reported trouble sleeping. Anxiety. Many patients, both males but a little bit more common in females, is a feeling of anxiety, a sense of impending doom. A lot of times women may go to the emergency room and complain of their symptoms, and it is often written off as anxiety or panic attacks, when really it is the warning sign of a heart attack. Many of the signs and symptoms of a heart attack can be very subtle and difficult for the patients to recognize. In addition, when patients do recognize the signs and symptoms, sometimes when they go and talk to their primary care doctor or the emergency room doctor, the doctors don't recognize them as signs or symptoms of a potential heart attack. Therefore, it is very important to listen to your bodies, and if you think that something is wrong, or if you're experiencing any of these signs or symptoms, whether they be typical or atypical, that you do seek medical attention And if you feel like nobody is listening to your concerns, then I urge you to go ahead and get a second opinion.